Hello, this is Dr. Gay from First Look MRI, and this is a 74-year-old female who complains of shoulder pain. She had done yard work recently, raking, and afterwards her shoulder began to hurt. She had no major trauma, just a shoulder pain after the yard work. And on this view here we can see the humeral head, which is round, rotating in this cup. This is called an axial view, where we're slicing from you can see where we are over here. This is a straight-on view, a coronal view. We're above the rotator cuff, going down, down, down through the humerus, down below the shoulder here. So this is called an axial view, and we see that there's a thick rind of abnormal signal over the top of the rotator cuff and deep to this muscle called the deltoid. And so this thick rind has these little nodular areas of low signal within it. The rotator cuff we see over here, this is part of the rotator cuff musculature called the supraspinatus muscle. It's gray, and then the tendon is here, this dark band. It actually looks pretty good. So this process is predominantly over the top of it, over the bursal surface. And it has this, again, mottled areas of low signal in the middle, and then this foggy brightness or inflammation over the top. Some of the inflammation actually goes into that deltoid muscle belly, which we can see down here. The deltoid is right here. You can see the edema in the deltoid muscle. There's one of the central tendons, and over here we see edema in the subcutaneous fat here too. So lots of inflammation and edema. But the process is predominantly over the bursal surface of the rotator cuff, and it has these little nodular areas. Now these are probably calcifications, and we confirm that here with this. So these are definitely calcifications now that we have the x-ray. On the prior exam you wonder, could there be something else? Could there be a little infection? But here we did x-ray, and we can see that these little dark things on the MRI turned out to be white calcifications here on this x-ray where bone is white. So this is definitely a case of calcific tendinitis or calcific tendinobursitis, where there's inflammation over the bursal surface of the rotator cuff. This is very severe, this really thick rind of inflammation. And again, the edema is so severe that it goes into the deltoid muscle, probably the most severe case of calcific tendinitis I've seen. But the good news is, as painful as this can be, it will usually resolve spontaneously. It takes sometimes several months, but eventually this will get better, and these calcifications will resorb, this inflammation will go away, but right now it's in a really severe active phase. So the rotator cuff is not torn. The labrum, this little triangle up here at the top, and then triangle down here, that's not torn. There's no arthritis of the shoulder. It's just this one thing. They have a severe calcific tendinitis that hopefully will get better eventually. And that's it. Thank you so much.